This tape job can correct two problems. One, it can treat plantar fasciitis. Does everybody know what plantar fasciitis is?
Yeah.
Where the plantar fascia runs along the bottom of your foot. It's what holds up all of the structures that pass underneath your foot and creates your arch. Okay? Hers are really tight. Oh, smokes. We have two major arches in here. So when we do this tape job, we're going to take the foot, we're going to bend it this way, and we're going to lift this arch. So we're going to take the bottom of the foot and go like this. Okay? When you do that, you shorten the plantar fascia. So if this is inflamed, then putting this tape job on will often help relieve that pain. What it also does is it lifts the arch and takes the stress out of that fascia that's usually drooping. Okay? The other arch you have in your foot is here. Right? So what we're going to do is this one goes straight on the skin. There's no pre-wrap on this one. You're going to spray this down like crazy. As soon as she starts to sweat, it's going to pop right off, right? We're going to do two things to remember in this is big toe, little toe, inside out, or lateral to medial, okay? So, we're going to put this on. Because she's got higher arches, I want to kind of smooth this in. This is just an anchor, okay? If you pull it tight, straight through here, it sits up high, and will have a tendency to kind of bow out. Don't be afraid to just kind of set it in there. We're going big toe, little toe, okay? Don't get up in this space in the toes, because that creates blisters. And it'll start creating pressure points, right? So we want to be just kind of on the knuckle. Then you're going to split your tape down the middle. And we're going to do some teardrops. We're going fat pad to fat pad. We're not wrapping around the ankle, or around the foot, okay? Keep your foot up. We're going right here to the fat pad. We're going to wrap around the back of the heel to fat pad at the little toe. You're going to do 4 of these. There's a lot of variation in this. Beav likes to alternate. Some people go big toe to big toe and then little toe to little toe. If you look this one up online, there's 100 different ways to do it. This is the way I prefer. This is the way you'll do it for class. Okay? And again, you can kind of see how I'm fanning it out just a little bit so they're not all exactly right on top of each other. Okay? So this is taking care of this arch here. Alright? Now, if I've done 4 strips, I should be back to pretty much an even roll, right? Now we're going lateral medial. We're going to lift this arch. Okay, so we're going to start here. You're not going to crank and squeeze her whole foot in, because otherwise it can't walk. We're just going to kind of come through, anchor to anchor. You're going to cover by at least half each time you come through. Okay. And you're going to come right back in here to the fat pad on the heel. The whole heel doesn't have to be covered. You can if you want, but for sure you need to be on the back side of where this comes together in the V. Okay? So we've done that. Now, you're just going to cover up your loose ends. Okay? That's longitudinal arch. Make sure you all step down on this because it feels like you have a shoe on and you're barefoot. Okay? Now in real life, I can't leave this like this because stand up. Walk for just a second. And now sit back up. She's got good dry skin, so this stick. This will, as soon as she starts to sweat, this will pop off and will no longer be effective. We always cover this with stretch tape to hold it up, to hold it in place.